Hey guys, I just wanted to put together a quick little video kind of going over some of the intricacies of drug administration. One of the things I wanted to go over is the real importance of checking medications 3 times. Check it once when you get it out to make sure it's what it is and what the concentration is. And then while you're drawing it up, make sure you're checking it again. And then the third time when you're administering it, you need to think one more time, this is what I'm wanting to administer. I got it out of the right vial. Because as you can see here, these two medications look surprisingly similar. And a lot of times they're actually kept together. So one on the left is ondansetron, which is also known as Zofran, as you guys know, hopefully, and then lorazepam, which is known as Ativan. So one's an antiemetic, has very few side effects. The other is a benzodiazepine. We know it sedates, has amnesia effects, can affect blood pressure. So you can imagine if you wanted to give someone an antiemetic, and then you gave them lorazepam instead, you could cause the patient, of course, to become very sleepy and sedated. But if you didn't realize that you'd done that, you might start wondering why your patient's becoming sleepy and sedated, and then start treating them for something else that they really don't have, but is something that you caused. And that's called an iatrogenic injury when we cause that. So you can see the importance of checking these medications. So the next one I want to show you are these medications. So you can see they all look kind of similar. They're all in a dark bottle, and they kind of all have some different types of things that they do. So one's thiamine, we know that's a vitamin. The next one's diphenhydramine or Benadryl, and you can see it's in a dark bottle. And then the next two is midazolam. We know midazolam is Versed, and it's another benzodiazepine sedative. But look, these vials are exactly the same size. This one has 2 milligrams per milliliter. This one has 5 milligrams, 2 milligrams per 2 milliliters, so 1 milligram per milliliter. This one has 5 milligrams per milliliter. So you can imagine if you thought you were carrying this and someone had restocked this, and you wanted to give someone a milligram of Versed, and instead you drew up what would normally be 1 milliliter out of this, and you drew it up out of this, you'd be giving them 5 times more than you had thought. Or the other way, you draw up what you think is 5 milligrams and you give half of it to give them 2.5. Over here you'd only be giving them a half a milligram. So it's really, really important that you check the medications that you're giving. Here's another example. These are 2 fentanyl vials, and depending on what you carry on the ambulance and what's restocked and what they have in the emergency room, you might be dealing with one of these. These are 2 that we carry here in Farmington. So the first one is a fentanyl, and we know that's a pain medication. That's 100 mics per 2 milliliters. And then the one on this side is a bigger vial. It's 250 mics per 5 milliliters. So if you do some quick math, you can figure out, and it says right below them, it says 50 mics per milliliter. And on the bottom of this one, it says the same thing, 50 mics per milliliter. So the same concentration, just 2 different sizes of the medication. Now remember what I said in the other talk was when you draw up a dose for somebody and you figure it out, the math in your head, or you write it down, especially when you're new to this, is if you're having to draw up more than 1 vial, either way, you need to consider that maybe you're giving the wrong dose. So like if you're using this vial and you're having to draw up 3 of these vials, you might recheck your math or ask your partner. You should always be asking your partner about just reconfirming doses with them. And then the same thing with this. If you're drawing up more than 1 vial of this, you really should be considering what you're doing. Okay, so this is the next one. These are 3 medications that kind of live together in the same bag usually for RSI, and so you have amidate or etomidate, which is a sedative hypnotic, mostly a hypnotic, and we use that for RSI, produce rapid unconsciousness. Ketamine, which can be used for pain, sedation, analgesia, used as for violent patients, used to induce unconsciousness and rapid sequence intubation. And then we have fentanyl, which is our pain analgesic type medicine. And I've seen these two kept together and mistaken. And so someone thought they were giving 100 mics of fentanyl, which is 2 milliliters, and instead they're given 100 milligrams of ketamine, and the patient starts acting funny. They start seeing things or start picking things out of the air. And then usually when these mistakes are found, when they're being restocked, they go back out and they say, hey, we used fentanyl, but there's no fentanyl missing, but there's a ketamine missing. Or, hey, we gave someone Zofran, but there's a lorazepam missing. That's usually when these things are found. Or, of course, if the patient has a bad outcome. The next one I want to show you is, here's 3 containers of the same thing. So, succinylcholine, we know it's a paralytic. It's also known as Anectine. That's a brand name of it, and you can see the generic name underneath it there. It says succinylcholine. These are all the same strength. I haven't seen succinylcholine come in a different strength, at least in our hospital. I just wanted you to make sure that you knew that there were different containers for the same medication, and usually a hospital will have several containers for the same medication. So this one's a pre-filled syringe. You can see you just pull off the white cover and then you're ready to go. These ones have to be drawn up with a needle into a vial. The next medication I wanted to show you is vecuronium, and the reason I want to show you this is because it actually comes in a powder form. I don't know if you can see that in this light. There you go, you can see the powder in there. And so what you have to do with this medication is, before you draw it up, you have to mix it. And so usually it says right on there 1 milligram per milliliter when reconstituted to 10 milliliters. And so usually what you would do is take a 10 milliliter flush like this and just instill the 10 milliliters into here, kind of shake it up a little bit. This actually reconstitutes pretty easily. There's not lots of little things floating around, and then you just draw it up out of the vial, and you can see this one's reconstituted. And then you just want to give the right dose, which is for the first dose is 0.1 milligrams per kilogram. So if you had a 100 kilogram patient, you'd be given all 10 milligrams. Once again, you can see these are 2 different vials. They're both from the hospital here, and so a lot of times what will happen is one company will stop making it, so they'll have to source it from somewhere else, or the company will change their packaging, or they'll just find somewhere cheaper to get it. And so you always have to kind of pay attention to how things are packaged. The best thing to do, of course, is to look at the name on the side, look at the dose or the concentration, so that you know what you're giving. How many times should you do that? 3 times. So let's draw this up. We're going to draw up the vecuronium. So we had that 100 kilogram patient, and we need to draw up, let's say we're giving it to a 50 kilogram patient. What size syringe would you need? Well, you want to make sure you get the right size syringe. And so for this patient, we want something that would hold at least 5 milliliters, right? Because if they're 50 kilograms and we're giving 0.1 per, that's going to end up being 5 milligrams, which should be 5 milliliters. And so this has got a blunt needle on it. You would take the top off if you touch the top, you'd want to clean it with an alcohol wipe. If not, then it comes sterilized, so you won't have to do that. And then pull out your 5 milliliters. Now you can see right away that when I let go of this, everything shoots back in. And the reason is sometimes the medications aren't sent with a lot of air in them because they don't want the air to expand when it goes up to elevation. So what you can do to make it easier is kind of start with how much you're going to draw out in start with that much air in the syringe. And so there I have 5 milliliters. Stick the blunt needle in, and you can push a little bit of it in, and you can see now it comes out a little bit easier. That usually works pretty good. You want to make sure all the air bubbles are out. So there's our 5 milliliters of vecuronium. Now, one thing is, you saw me recap this. Of course, you never want to recap a needle. This is a blunt, and I'm just demonstrating, so I probably shouldn't have done that. But you know, if you weren't going to use it right away, you want to make sure that it's covered. So the other thing too that brings up is if you're not going to use a medication right away and it's just in this unlabeled syringe, you should probably label it. So what should you label it with? Here I'm going to put Vec, and I'm going to put 1 milligram per milliliter. So now I know what I've got in there. So I'm not giving the Vec when I should be giving the Amidate. I'm not giving, you know, midazolam when I should be giving Amidate. You don't want to get things mixed up. So, which can happen in the heat of the moment for sure. So here's another example of removing the right medication. So here we want to give someone some Versed. Let's say we're gonna synchronize cardiovert them. We want to give them a little bit of sedation beforehand, and so we've decided we want to give them 2.5 milligrams of Versed, and this is a 5 milligram per milliliter vial. So we know we want to give a 0.5 milliliter of this. So when you're looking at your syringes and trying to figure out what to use, if you're using a big syringe, we know we want to get a 0.5 milliliter. You can probably do it. I mean, you can see the markings on the side there, and so you know, a 0.5 milliliter would be about right there. But really, if you use a smaller syringe, it'll be a lot easier. So you know, I would at least use a 3 milliliter syringe. The syringe that I like to use when I'm giving things that are less than a milliliter is a 1 milliliter syringe. So this is a 1 milliliter syringe we carry on the helicopter. And unfortunately, these are hard to find. We have to special order them. Usually what you find are TB syringes, and TB syringes work fine. The only problem with a TB syringe is they don't have a lure lock. What they have is a slip tip, and with our needleless system, they don't work so hot. So if you look at here, now we're going to draw out a 0.5 milliliter. Get that air bubble out. And you can see it's much easier to see right at the 0.5 milliliter mark how much you're giving. Because I mean, imagine, you know, if you're giving this now to a 10 kilogram patient and you're giving, well, that's not a good example, because if you're giving 0.1, that's going to be a milliliter. Let me think. If you're giving, this is why you should write this stuff down. If you have a 10 kilo patient and you're giving 0.1 per kilo, that's going to be 1 milligram, right? And there's 5 milligrams per milliliter, and so you're going to be giving 0.2. So that you're giving 1 milligram of this concentration. And that's much easier to do than it is on a 3 milliliter syringe. So Anyway, let's move on to the next medication. This is a kind of a pre-filled syringe. It's actually a it's designed to go in a special administration set called a Carpeject, and basically it slips in there. You can see in the end there's a little plunger with a screw on it, and so it's just screws in, and what you have on this end is a lure lock for a needle, or to hook right into your needless system, your like your buff cap or hep lock or saline lock or whatever you've got there, or right into the IV port on your administration set. And you can see that they come marked, and so they've got markings all along here showing how much you're giving. And so they usually come with quite a bit of air, and so you need to get the air out first. And you can see this is 10 milligrams per milliliter. So every small line is 1 milligram of morphine. The thing you have to do if you're not using the Carpeject, you can do one of two things, because usually people don't have those, they lose them, is there's a little rubber port there. You can actually draw it up into a 1 milliliter syringe to administer it. You can, to actually access, to make the medication come out of this, you have to push it down. And what that does is, if you can see in here, I don't know if you can see that, there's a needle, and that actually penetrates the chamber there. And then you push from this side. And so for a long time in the ER, what we did was we would get a cotton swab, and that we kept in the ER, and we would actually just administer it by pushing on the end. And you can see it pushes the plunger and pushes out the medication. So probably not the best way to do it. You don't see a lot of medications come like this anymore. Basically morphine and let me see, I had another medication here. I want to show you how similar they were too. Valium. And so you can see how very similar these are. So if you just like are looking for the color, you might get mixed up, and you might give your seizing patient a bunch of morphine and wonder why they're not stopping seizing. So you want to make sure you know what you're actually giving. Again, you want to look 3 times. This is another thing I wanted to show you. It's a MAD device. That stands for intranasal mucosal atomization device. And so basically you have this little tip on the end of the syringe, and the tip is kind of a foam rubber tip. And what you can do is atomize different types of medications into the patient's nares to administer it. So, you know, there's some medications we can give that way. Narcan is probably one you're familiar with given that way. We can also give fentanyl that way and Versed that way. One thing I'll tell you, so you'll know, I found out the hard way, is fentanyl tastes really bad. And I had a patient that was pretty broken up. I gave her fentanyl through her nose, and she actually refused any more fentanyl because it tasted so bad. So, and she had 3 broken bones, so it must taste really bad. I don't recommend tasting it, but anyway, you can learn that the easy way instead of the way I did, the hard way.